What if the little things you forget today were the whispers of something deeper tomorrow? Alzheimer's disease often begins its devastating course with barely noticeable symptoms, ones that are all too easy to dismiss as mere forgetfulness or aging. However, recognizing the early signs can change the course of someone's life. The earlier Alzheimer's is identified, the more control families and patients have over planning, care, and quality of life. With an estimated 55 million people living with dementia worldwide, time is of the essence. Alzheimer's is a progressive neurodegenerative disease that primarily affects memory, thinking, and behavior. Its first stage, known as mild cognitive impairment due to Alzheimer's, can be subtle and slow. The changes are gradual, which is why so many people miss them. These early signs are not simply a part of getting older, they're the red flags that need our attention. One of the most common and alarming symptoms is memory loss that disrupts daily life. Unlike forgetting a name and remembering it later, individuals with early Alzheimer's may ask for the same information repeatedly or rely increasingly on memory aids like notes or electronic reminders. They might forget important dates, appointments, or even the names of close family members. Difficulties in planning or solving problems also surface. Simple tasks like following a familiar recipe or keeping track of monthly bills become overwhelming. People may lose their ability to concentrate, and tasks that once took minutes may stretch into hours. Another sign is trouble understanding visual images and spatial relationships. This can manifest in problems with depth perception, judging distance, or reading. As a result, driving can become dangerous, putting both the individual and others at risk. Language problems are also common. Individuals may struggle to follow or join in conversations, lose track of what they're saying, or repeat themselves. They may stop in the middle of a sentence with no idea how to continue or call everyday items by the wrong names. Misplacing things and losing the ability to retrace steps is another telltale symptom. Someone might put their keys in the freezer or their phone in the laundry basket, then accuse others of stealing it because they can't remember doing it. A concerning shift in mood and personality can also emerge. Someone who was once outgoing might withdraw socially or become suspicious, confused, depressed, or anxious. These emotional changes are often misunderstood or misdiagnosed, further delaying proper intervention. Recognizing these signs is not about fear, it's about empowerment. Awareness leads to timely diagnosis, which opens the door to treatment options, lifestyle changes, and support systems. It allows families to prepare and make decisions that honor their loved one's dignity. If you notice these symptoms in yourself or someone you care about, don't wait. Consult a healthcare provider as soon as possible. Early detection can bring clarity, direction, and a greater sense of peace during a difficult journey. Have you ever noticed any of these early symptoms in someone close to you?